Our topic is about inferring how one's lifestyle can affect the functioning of the respiratory and circulatory systems. Let's begin. Our lifestyle and our exposure to viruses or bacteria and other environmental pollutants may increase our susceptibility to respiratory diseases. These diseases may prevent the respiratory system from functioning well. Let's discuss some of these diseases. First is the common cold. Common cold is characterized by sneezing, runny nose due to nasal congestion, and mild fever. It is caused by viruses infecting the upper respiratory tract. It usually lasts for about a week and could be relieved by taking enough rest and drinking a lot of fluids. However, if symptoms last for more than a week, it is advisable to seek proper medical treatment and cover the mouth when coughing or sneezing to prevent the virus from spreading. Next is influenza or flu. It is characterized by chills, fever, severe headache, muscular pains, runny nose, and fatigue. It is caused by influenza virus that may come from birds or swine, which can be transferred from person to person through sneezing, coughing, or touching surfaces. Flu may last for 2 to 5 days, but in severe cases, it can last for more than a week and can lead to pneumonia. Flu can be treated with enough rests, drinking a lot of fluids, taking antiviral medicines and vaccines. Now let us discuss pneumonia. Pneumonia is an infection of the lungs. It happens when the alveoli become inflamed and filled with fluid which is caused by bacteria, virus, fungi, or protozoa. Pneumonia is characterized by cough, chest pain, fever, and difficulty of breathing. Pneumonia can be treated by taking all prescribed medications. In case of doubt, pneumonia can be confirmed via chest X-rays accompanied by a blood test. Tuberculosis or TB is a chronic disease caused by Mycobacterium tuberculosis, which can be transferred from one person to another through coughing, sneezing, or spitting. People with TB may experience the following signs and symptoms. To prevent the transfer, people with TB should use his own eating utensils. TB can be cured with proper medication for at least 6 months. Asthma is a chronic and allergic condition. People suffering to asthma experiences the following signs and symptoms due to production of extra mucus. When breathing, airways swell and become narrow. The exact cause of asthma is unknown, but it can be triggered by inhalation of dust, pollen, and fur. Asthma can be relieved by eliminating the triggering agent or using bronchodilator. Bronchitis is the inflammation of the bronchi. It is usually caused by virus and bacteria, but can also be triggered by industrial pollutants and tobacco smoke. Bronchitis is characterized by a cough with phlegm and difficulty in breathing. Bronchitis can either be acute or chronic, and these are their characteristics. Acute bronchitis lasts for 1 to 3 weeks. It can be treated with enough rest and drinking a lot of fluids. On the other hand, chronic bronchitis lasts for 3 months or more. It can lead to the production of excessive mucus and infection from microorganisms. The treatments that can be used are antibiotics or proper medical attention. Emphysema is a chronic disease where the alveoli as well as breathing passages are damaged due to prolonged exposure to tobacco chemicals and air pollutants such as fumes and coal. People with emphysema suffers from difficulty and pain in breathing since some parts of their lungs are damaged. These damages cause difficulty of getting enough oxygen as well as of eliminating carbon dioxide. Emphysema has no treatment, but its progression can be slowed down when the patient stops smoking. Using bronchodilators, antibiotics, oxygen supply, and surgery to remove the damaged tissue might also help. COPD, or the chronic obstructive pulmonary disease, is the term used for people suffering to any combination of the following lung diseases. So, the patient that acquires emphysema has no treatment available. People with COPD may experience difficulty in breathing due to long-term obstruction of airflow. The possibility of pulmonary infection may be slowed down using antibiotics. COPD is caused by tobacco, including the secondhand smoke. Thus, smoking should be stopped. Lung cancer can be acquired from long-term exposure to tobacco smoke. Tobacco contains carcinogenic chemicals which can cause uncontrolled growth of tumors. These tumors may occupy the space in the lungs which is supposedly used for gas exchange. The symptoms of lung cancer are coughing with blood, mucus production, weight loss, shortness of breath, and blockage of airways. There are some ways to treat cancer, such as chemotherapy, radiation, or removal of the damaged part. We can spare ourselves from suffering from respiratory diseases by avoiding smoking, washing our hands often, restricting from going to places where we can be exposed to too much pollutants, and taking enough rest. In summary, respiratory diseases are usually caused by exposure to bacteria, viruses, and environmental pollutants such as tobacco smoke, coals, and fumes. Some respiratory diseases could be relieved by just enough rest and drinking of a lot of fluids, while some require serious medical treatments. We can also improve our lifestyle to spare ourselves from respiratory diseases. Here are some diseases of the respiratory system discussed in this lesson. This is the end of the presentation. Thank you.